Here's something most parents have probably done, cuddled up, sleeping right next to their baby. But a new anti-co-sleeping ad from the Milwaukee Health Department is causing some controversy. We want to show you this. The poster shows a baby lying in bed next to a large butcher knife with the headline, "Your baby sleeping next to you can be just as dangerous." The health department's message, bed sharing with parents is not safe. But some say these ads go too far. Joining us now for more on this is Dr. David Nelson. He's the professor and chairman of the Department of Pediatrics at Georgetown University Hospital. Doctor, thanks for being with us.
My pleasure.
I have to say, when I first saw this ad, I was taken aback. My first impression, it goes too far. Curious what your reaction is.
Well, this is the first time I've actually seen the ad. I guess I'd leave it to others to decide whether that's the proper marketing to use. That said, I think the message about co-sleeping is very important. I think many parents don't realize the dangers involved in co-sleeping. So any way that the message can get across, I think, is the way to go.
Well, and just to be fair, how the ad came to be, apparently Milwaukee Mayor Tom Barrett said when he first saw the ad, he was also concerned they were too provocative and raw, but he says he gets these calls about babies who die in the beds of their parents, and he says he shudders when he gets these calls, saying it's just such a preventable death. I'm curious if you know what the rate of infants dying because of sleeping in bed with their parents is nationwide.
I don't think we know the exact rate, but what we do know is that since the early 90s, when we started the Back to Sleep campaign, advocating for babies to sleep on their backs, the rate of SIDS or unexplained death has gone down dramatically. But over the last several years, it's leveled off and actually risen some. And it looks like from the data that we have that the increase is due to some things like co-sleeping, like having certain kinds of toys or blankets or stuffed animals in cribs, bumpers, mattresses that don't fit, having babies sleep on soft surfaces like water beds, those or pillows. Those kinds of things all contribute to the somewhat slight but real increase in deaths we've seen from sudden infant death syndrome.
So is the issue that parents are inadvertently rolling over on top of the babies, or is it, as you said, a matter of all the covers and the mattress that may not be fit for an infant?
It's both, actually. There's been instances of parents being very tired, rolling on an infant, really not knowing that they did it. There's been instances of babies suffocating because of soft pillows or blankets. So it's really a whole group of things that cause this. And the sad thing in many ways is that this is all preventable. And we should be seeing really virtually no deaths of babies because of sleep issues.
And Dr. Nelson, let me just ask one quick question here. I have, with my children, you know, those first 3 months at least are very, very sleepless. It can be so tough, especially if you're nursing. We put our kids on a foam incline with bolsters on either side so they couldn't roll over, so they were on their back to sleep. Is that an alternative for parents? Is there any other alternative, very quickly?
Not really. There are many things on the market. None of them seem to really be all that effective. So our recommendation as pediatricians and the American Academy is that these things to prevent it or to keep babies on their side or whatever really aren't very effective and shouldn't be used.
Okay, very good. So just don't put them in bed with you at all.
Correct.
Doctor, thanks for being with us. Appreciate your insight on this.
My pleasure.